Thank you, everybody, for attending our OSHA Compliance webinar hosted by MedPro Disposal. OSHA Compliance is something we're going to dive fairly deeply into and describe the solution that MedPro has to keep everybody in all medical facilities compliant with OSHA guidelines. But before we get there, I'd like to give you a bit of background of MedPro Waste Disposal as a company. MedPro was formed in 2009 in response to a common complaint throughout the healthcare industry. That complaint was that there's no alternative in the market. Currently, 80% of the U.S. market is served by one common vendor. OSHA Compliance is a required service, which is a service that MedPro provides. MedPro is also a full-service medical waste disposal provider. What that means is that we not only provide waste disposal, but we also provide pharmaceutical disposal and OSHA training services, which is what we're discussing today. What does it mean to be in compliance? Compliance is something we talk about a lot, and that word is used very commonly in the medical industry. All employees who come in contact with bloodborne pathogens must receive annual training. It's about safety, awareness, and accountability. Every day there are scenarios where employees could be injured. At the end of the day, what compliance is really about is making sure that every one of your employees feels safe when coming to work, that they're aware of their surroundings, and that if something were to happen, there are proper procedures in place that would hold everybody accountable. MedPro's compliance program. Compliance with OSHA in general is very large in scope, so what we've done is gone ahead and narrowed it down to the fields that are required at a medical facility. First and foremost, we'll take training modules. What you'll see in the top left corner is HAZCOM, BBP, also known as bloodborne pathogen training, and HIPAA training. We'll start with bloodborne pathogen training, the most common. It needs to be done on an annual basis by all employees in the building. Now, the most common question we get is, what about the receptionist at the front desk? Yes, everyone, including the doctors, must take annual bloodborne pathogen training. HIPAA training only needs to be done once every 3 years for those that are involved with patient confidentiality. HAZCOM training is a new training that was introduced in 2014 and as of now only needs to be done once. With new HAZCOM trainings, MedPro will update our compliance portal to go ahead and provide that to you. On our portal, you also get your MSDS sheets, as you will see top center. All of your MSDS, now commonly known as SDS sheets, are simply searched in our view. There's a tab in our portal that says My MSDS. You would click that and search any SDS you would possibly need. It will create a nice little folder for you, and of course you can print them out, but that's not necessary. You can go ahead and keep them all in your portal so that anytime you need them, you may log in and find them extremely conveniently. You can also perform audits on all of your facilities. This is something that is important as far as asking yourself, am I compliant in a certain aspect of our facility? Online safety audits can be done anytime. There are simple questions that will walk you through your facility. Yes, no, not applicable, and maybe are the common answers. As you go ahead and answer those, they will let you know if they are compliant or not. Now, we are going to go into the ICD-10, bottom right. This is something that most of you are probably pretty familiar with, that the ICD-9 codes have now transitioned fully to ICD-10. We do have a conversion tool so that you'll be able to type in any ICD-9 code and convert it over to ICD-10 should you need a solution for that. The online safety programs are another very important aspect. They are hazard communications, exposure control, fire prevention, and emergency preparedness. These are 4 plans that are required to be had at your office and kept up to date at all times. Most of these plans, if done correctly, will take about 2 weeks. Our online safety plans are fit to your facility. It's very easy. Each one takes about 30 minutes to an hour, depending on length and depending on how quickly you get through it, but they are all very simple. They can be saved online in our portal, or they can also be printed out and put into your local OSHA binder. Now we will look at regulations, bottom left. If anything were to change due to the OSHA regulations, we would update you throughout an automatic email, and you would also see it on the front page of our OSHA compliance screen. For example, when there was the Ebola scare a couple months back, our website contained very helpful, useful information that several people would log on to download some PDFs and read frequently as a just-in-case type of thing. Now, if anything like that were to happen again, of course, we will keep you completely up to date. Tutorial. At this point, you're probably asking yourself what the program actually looks like. I just want to mention very quickly that this is something that is extremely user-friendly, very convenient, and easily used by almost anybody. What I highly suggest you do is go ahead and visit medpro-disposal.com/online-OSHA-compliance-walkthrough. That will show you a very quick, brief view of our online portal. I promise that as soon as you see it, you'll realize that it is very simple and easy. Penalties. Now, this is the part that nobody likes to admit, but it is a real fact of OSHA compliance that if you are out of compliance, you will find yourself being fined. Now, fines are one portion of it, and it says there are upwards of $7,000 and more for a HIPAA violation. I'll give you an example. Should someone get stuck with a needle inside your facility and you are found to be out of compliance, let's say that person did not have proper bloodborne pathogen training, if someone in your facility were to get stuck by a needle, your company would be required to give the proper tests for the next 6 months and pay for that. Now, if for some unfortunate reason that person contracted some type of disease from that needle, your facility would be required to pay for that medical care for the next 5 years. That would certainly exceed a fine of $7,000, but it would be on top of that fine. So, it's something to be very cognitive of. Something we mentioned very early on, which is you want your employees to feel safe. This is one of the ways you can do it through OSHA compliance. You only get one warning, and a facility can be shut down through not following the OSHA laws. It can be shut down in one of two ways. Number one, OSHA obviously can come in and say, this is a completely unsafe working environment, and close your doors. Number two is the fines that can be levied by OSHA can be practice crippling. This is something that can shut your doors financially, not because OSHA says it's completely unsafe, but due to all of the fines that you received, it may be financially unviable to continue to move forward. For any specific regulations, you can always consult your local health department as well with any questions about updates on regulations. And if you are unclear about certain specific procedures, there are another education source for you to utilize, should you need it. Well, that concludes our webinar for today as far as OSHA compliance is concerned. If you have any questions at all, I highly suggest giving us a call. If you have a question, we've probably heard it before, and we probably have a very quick and concise answer for you. So please feel free to call us at 888-339-2976. One more time, that's 888-339-2976. Thank you. This concludes our webinar hosted by MedPro Disposal. I appreciate you all tuning in.